I'm Dr. Frita. Let's talk chest pain. 5 signs and symptoms you may be having a heart attack and not even know it. Have you ever had chest pain that was bad enough for you to go to the ER and you get there, you have $1 million workup, only to be told that your chest pain is not a heart attack and that it is non-cardiac? But when you get home, you're still having the chest pain. This is actually not an uncommon scenario because there are many causes of chest pain that are not heart attacks and not even heart related. So today we're going to talk about chest pain. I'll give you the types of chest pain. I'll talk about the different causes of chest pain. And when it comes to heart attacks, I'll give you 5 signs and symptoms that you may be having a heart attack and not even know it. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. I'm Dr. Frita, an MD who has been triple board certified, and today we're going to talk chest pain. 5 signs and symptoms you may be having a heart attack and not even know it. There are so many different causes of chest pain, and many of them have nothing to do with the heart. The issue is that heart disease is the #1 cause of death in the United States. And so if you are having a chest pain that's related to heart disease, you definitely don't want to miss it. So we're going to break it down. Now, this is very important. If you're having any type of a chest pain that is prolonged, or if you just don't feel comfortable, if you feel like it may be a heart attack, don't waste time. Call 911, go to the emergency room. Don't try to make the decision at home. This discussion, however, will help you to distinguish some of the more obvious causes of chest pain that are non-cardiac that can help you to make your decision. So there are different types of chest pain. You can have a stabbing chest pain that feels like there's a knife kind of going in and out of your chest area. You can have a dull chest pain. You can also have an electric chest pain, something that kind of goes through you from one side to the other or in the middle of the chest and it just hits real quickly, almost like an electric shock. You can also have a tight pressure-like chest pain, something that feels like an elephant is on your chest. And the chest pain can come and go. If it's a chest pain that comes and goes pretty quickly, then it's not likely to be heart pain, but it's possible. If, however, you have a pain that has a long duration, and certainly if it feels like a tightness, something heavy on your chest, that could very well be a serious pain. Again, any pain that is causing you to be unsure and you think that it might be a heart attack, don't hesitate. Go be evaluated by your doctor or 911 if it's severe. Now let's talk about the anatomy of the chest. There are many things in the chest other than just the heart. You start off with the layers. You have the skin layer, and then you have the subcutaneous fat, or the fat right under the skin. And then you have the breastbone or the sternum. And of course, next to the heart on either side, you have the lungs. You have the pleura, which covers the lungs. You have the heart, but before you get to the heart, there is the sac or the pericardium in which the heart sits. And then, of course, you have the spine as well. And then you have the aorta, that large artery that leaves the heart. It's also in the chest area. My point is, there are many things in the chest other than the heart that could be related to chest pain. Oh, and I didn't even mention the esophagus, the tube that connects the mouth to the stomach, also in the chest area. With all of this anatomy right here in the chest area, then it really doesn't surprise you, I'm sure, that there are many things other than just heart attacks or heart disease that can cause chest pain. So now let's talk about some of the causes of chest pain, and I'll kind of go layer by layer. Let's start with the skin. Shingles. Shingles, or the reactivation of the chickenpox virus, is something that can cause a chest pain, especially if you get the shingles right in the dermatome or the skin area that involves the chest, particularly the left chest. So it could wrap around the front of the chest to the back, and it can be a chest pain. Now, typically the shingles will present with some type of a rash, like a blister-like rash. And so if you have someone who presents with chest pain and they have the shirt on and the physician does not get a full or detailed history and physical, they could just think that it's heart pain just because it's on the left side. But it's important to pay attention to your skin and make sure you don't have any lesions, because shingles could be a cause of chest pain. And then moving on down, you could certainly have musculoskeletal pain. You can have a sore sternum, okay, or a breastbone. You can also have issues or inflammation in the skeleton, in the musculoskeletal area. Now, typically, this pain can be reproduced, meaning that when you are examined and the doctor pushes you at the site of the pain, if it's musculoskeletal, then it will probably hurt when it's pushed, whereas chest pain due to cardiac disease typically is not reproducible just by a simple touch, usually. And so, yes, musculoskeletal pain can be an issue. And then moving on to the lungs. You can get blood clots in the lungs or pulmonary emboli. And this happens if you have a blood clot from somewhere in the body, like in your lower extremity, like a deep venous thrombosis in the leg, and that blood clot breaks off, travels to the lungs, and it starts to block arteries of the lung and literally cause lung death. This is a pulmonary embolism. It can also be fatal, and so it's very serious. In addition to chest pain, you may have tachypnea or fast breathing, and you can get lightheaded as well. Please be sure to watch my YouTube video on DVT or blood clots after you finish watching this video. Other lung pathology that can cause chest pain includes pneumonia. You can get chest pain from pneumonia. Also, rarely but possible if you have a pneumothorax, or if there is a leakage or some air that's kind of leaking out of the lungs. Also, if you have inflammation of the pleura or the lining of the lungs, that could cause a chest pain as well. And then you have the actual sac around the heart or the pericardium. You can get something called pericarditis. Now, with pericarditis, this chest pain tends to be positional, and most people tend to feel better when they're leaning forward. When you have a typical heart attack or heart disease related chest pain, is usually not positional. It more depends on exertion, but we'll get into that. But pericarditis, inflammation of the heart sac or pericardium, is another cause of chest pain that's not a heart attack. Another cause of chest pain could be aortic dissection. Now, the aorta is that very large artery, the largest one, that leaves the heart. And the wall of the aorta has layers to it. If you get a break or a defect in the wall of the aorta, usually associated with very high blood pressure, then it's possible for blood to start seeping into that defect into the wall, an aortic dissection. This could cause severe chest pain. It can also cause severe back pain, but it's not a heart attack, right? And so an aortic dissection is another cause of chest pain that is not a heart attack. Again, having uncontrolled high blood pressure can put you at risk for having an aortic dissection. Please be sure to watch my YouTube video on the top 21 most frequently asked questions I get about high blood pressure, the truth behind high blood pressure. Another cause of chest pain can be GERD, or gastroesophageal reflux disease. That's why they call it heartburn. If you have GERD, then that pain can feel just like a burning chest pain. So it's not cardiac. It can be caused by GERD. So keep that in mind. If you're someone who has chest pain, you go in, you get a whole workup, and they say it's not a heart attack, make sure that you ask if you could have reflux disease. Gallbladder disease can also cause chest pain. So if you're someone with an inflamed gallbladder, if you have gallbladder stones or cholecystitis, then this pain can also be referred to the chest. There are many other causes of chest pain as well that aren't necessarily heart attacks. The esophagus, if you're having esophageal spasms, that can cause chest pain. You can also have heart artery spasms or coronary artery spasms, which can make it feel like you're having a heart attack. But if you get a heart catheterization or a procedure to see if you have any blockage in your heart arteries, those arteries may be totally clean, and of course, the heart doctor, may not see that they're spasming. And so you'll be told, well, it's not your heart arteries, but really it could be. One interesting fact about the heart artery spasms is that often beta blockers like metoprolol, atenolol, these typically are given because they're generally good for heart disease. But for coronary artery spasms, sometimes this group of medicines, beta blockers, can actually make it worse. These are just some of the many possible causes of chest pain that are not heart attacks. Just remember, if you're not sure, don't try to decipher it at home. If you're really suspicious, the pain is prolonged, if it's getting worse, or if you're just not comfortable, you don't know, activate the emergency medical system, call 911, call your doctor, get it checked out. So now let's talk about the chest pain that's associated typically with a heart attack. This will be a crushing pain, substernal pain. Patients may describe it as an elephant sitting on their chest. This is a pain that doesn't come and go. It's not electric. It's not a quick prick. It's not a quick stab. It's something that's going to hang around and you know that it's there. It may also be associated with some other symptoms other than chest pain. And that's what we're about to talk about, because I'm going to give you 5 signs and symptoms that you may be having a heart attack and not even know it, meaning not just the obvious chest pain, but the other signs and symptoms that you don't want to miss. One symptom could be nausea and vomiting. That's right. There are people who present with nothing else but nausea and vomiting, especially people who are diabetic. When you're diabetic, you oftentimes have neuropathy, especially if you're an uncontrolled diabetic or a new diabetic. And this means that your nerves may not be wired in the same way for your heart pain to present as chest pain. And so there's some patients who only present with nausea and vomiting, and that is their warning symptom of a heart attack. They can also present with a stomach pain or epigastric pain in the upper part of their stomach. So nausea, vomiting, epigastric pain could be a symptom you're having a heart attack and you may not even know it. Number 2, shortness of breath. Oftentimes people think that if you're short of breath, it's just associated with a lung problem or maybe asthma or COPD, emphysema. They may even be aware that you can get shortness of breath with anemia. But shortness of breath could be your only presenting symptom of a heart attack. You definitely don't want to miss that. Number 3, shoulder pain. If you're having a heart attack, that pain could be referred to your shoulder. It can be referred to your left shoulder, but it can be referred to your right shoulder as well. So please don't be fooled. You can have arm pain, shoulder pain, neck pain, jaw pain. Again, this could be a symptom of a heart attack that you could miss because it's not chest pain. And yes, there are patients who have presented to the ER, had shoulder x-rays, had full workups for shoulder and arm pain, and the real result, a heart attack or a myocardial infarction. In addition to arm and shoulder and jaw and neck pain, it could also present as more of a tingling. You get a tingling of the arms or even the hands as well, not necessarily just pain in the extremities. Number 4, diaphoresis, or being sweaty, can be a sign that you're having a heart attack and you may not even know it. So if you're breaking out into a cold sweat, if you're wet, you're clammy, especially if it's associated with some of the other signs and symptoms we've discussed, this could definitely be a sign or a symptom of a heart attack. Number 5, extreme fatigue. Yes, something as non-specific as being extremely tired could be a symptom that you're having a heart attack and you may not even know it. So please pay attention to your body. And if you notice that your energy level is way off, make sure you're evaluated by your physician. If you found the information in this video to be helpful and informative, please be sure to share it with someone you care about. Also, if you like this video, please be sure to press like. And if you haven't done so already, make sure that you subscribe to my YouTube channel. Also, please be sure to follow me on Instagram at Dr.Frita, where you get a glimpse into what I'm up to in my everyday life. I also share when I'm doing national news appearances, when I'm doing community service. I also just share some interesting things that happen as I try to live my life in a healthy and happy manner. And please be sure you check out my podcast, Healthy Happy Life Podcast with Dr. Frita. I thank you for watching. I always appreciate you for watching. And please do your best to live your healthiest, happiest life. I'm Dr. Frita.